should be physically fit, mentally fit, and robust, as well as socially also having a proper thinking and spiritual level. With this thing in mind, my health and my right is the theme given by WHO for us to follow and to bring and implement so many things in life so that there is a proper care of the patients as well as the health of the individuals who are not having a disease. That means the society should remain healthy and everybody has the right to have that healthy atmosphere all around. So there are various aspects to be covered during this year's theme. I am going to cover the aspect related to safe and quality care without any discrimination. Discrimination in the healthcare is a very important aspect. When any person, he or she, whether sick or not sick, whether requiring a care or only just a checkup and all that, there should not be any discrimination because discrimination is a negative action and it shows that we are partial to some people and we are trying to not help certain category, group, or whatever. So, discrimination is a thing which is bad for society. Discrimination of an individual or discrimination of a group of people, when it occurs because of a preconceived and unjustified opinion. Preconceived means people have already taken it for granted that will not help so and so group or person. Unjustified because there is no reason for it. So WHO wants the health care to be given to everybody equally without categories, which I am going to bring now. We must note that individuals who need the treatment, they may not be from a particular group or maybe from a particular group, but we remain unbiased and do not give any discrimination while treating any particular group of persons. Since discrimination is based upon the pre-perceived ideas, so it has to be strictly stopped, not discouraged, stopped. If harm does not happen in healthcare, that does not mean that there is no discrimination. So we should not have any partiality or try not to harm any particular group also. A group may be discriminated against if they receive something which is of less value than others are grouping. What it means is that supposing there is a immunization program going on somewhere, then it should be given to everybody equally. There is no bias for it is a poor person or a rich person. Now, certain examples of discrimination we bring to your notice. Commonest is gender bias, whether the person is a male or a female or transgender. WHO says, and every society understands that there should not be any partiality while treating or taking care of whether it is a male or a female, because diseases can happen to anybody and everybody. Second group which gets affected is certain disabilities or people who are specially able. So when it comes to that particular category also, not only we should not discriminate them, we should go ahead and help them in a better way because maybe that they require more help for their healthcare purposes. Social class is a thing which is present all over the world and everywhere. But when it comes to the point of health, we should recognize that all people socially are equal. There is no difference between various social groups. The needs are same, diseases are similar, the requirements are similar, the effects and the harms which may take place because of a particular disease or condition will be equal. So we should not be discriminate when treating or taking care of patients, oblique healthy persons. When we are following them, we should remain very transparent and straightforward on that. Socio-economic status also should not be a consideration. Like I gave the example of immunization. A disease can happen to a rich person, to a poor person, to a middle class person, a super rich person, or whatever. Disease and various infections, conditions, and all that, they don't discriminate between persons. So our treatment also should be equal for everybody. Then, when we come to the health care of persons, we should also be aware that many times we are not able to do the justice the way it should be done. Therefore, when we come to health care and all that, quality is a very important aspect. Quality is the key component. When the universal health coverage aspect of WHO comes, WHO wants that universally every person should be healthy. So then, in that case, quality matters a lot as to what type of treatment or care is being given. So for that purpose, it is very essential that we remain very safe. Injuries should not happen to people to whom the care is intended. What it means is that any hospital or healthcare facility which is there should be safe for them, for their movement. There should not be any fall cases. For their care, their drugs and injections which are given, they are all pure, and none of them causes any specific harm to that. Structure of the hospital or healthcare facility should be such that there is no injury because of movement on various floors. Facilities are available for disabled people also there. When patient is transported from one part of the hospital to another, there should not be any injury. Structure buildings should be such that there is no fire hazard or any chemical hazard of the products which are stored in the hospital. So that the patient care takes place in a safe way. Evidence based services are the ones which we require these days, and they are part of our system. So the treatment which is given should be effective and it should cover all aspects. The treatment has to be people centered in the sense that we are providing care to every individual such a way that there is no difference between them. What means timely is that we have to reduce the waiting time for the patients as well as healthcare related camps and other activities, immunization schedules, distribution of specific drugs to various groups in their houses or areas, any type of program and all that should be done such a way that there is no delay. People get the benefit of it. The moment there is a delay, whether in case of care in a hospital of delivering the treatment, or delay in case of any uh, programs related to healthcare facilities, time is a very important factor. The moment there is a delay, it will cause a bad effect and deleterious effect. Providing care equally to everybody is very important. What it means is that when it comes to the treatment of old people, young people, age wise, small children, and all that, there should not be any difference. The same quality is to be provided at every age. Similarly, same quality is to be provided to whether it is a male or a female, no discrimination or differentiation on the gender. Ethnicity means various cultural or social groups and various castes and all that. Health does not recognize any caste. A disease does not occur because of any caste, creed, or religion. So everybody has to be given equal thing. Disability part we have already covered, that disabled or any person requiring it should always be given a priority. Geographic location of quality of treatment matters in the sense that there are various parts in our country and all over the world where the health facilities cannot reach easily. WHO wants that such difficult areas also should be accessed, and they also should be provided equal type of best healthcare. Socioeconomic status should not be a hindrance in providing any quality care. All people of the similar social economic status should be treated equally. Integration means that the services are available at nearest place, and every service or maximum service should be provided such a way that a person doesn't have to go to different places only for a particular thing. That is why the aim is to have a integrated, complete system in a hospital or a healthcare facility, so that all facilities under one roof, if not possible under one roof, there should be co-located or nearby, so that the best healthcare facilities provided to everybody equally. Thank you. I have covered my part. I hand over to the next speaker. Thank you.